Hi, I'm Sam Schultz, one of the doctors of audiology here at Amdahl Hearing, and today I want to talk to you about hearing loss and the effect it can have on your brain. Back in 2011, Johns Hopkins University did a study looking at the effects of untreated hearing loss and the increased risk of dementia and possibly Alzheimer's. They actually found from that study that even a mild degree of hearing loss does double the risk of developing Alzheimer's later in life. And a more moderate to severe degree of hearing loss can actually increase that risk by 5 times. Now that study really opened the doors for many other research and other studies that looked into the correlation between peripheral hearing and the effects that it has on the human brain. And one of the studies that was looked at by our team here was the Lancet Commission that was done in 2017, which looked at a large group of individuals with Alzheimer's, and they found that 35% of those actually had modifiable risk factors that could have helped to prevent that chance of Alzheimer's. And actually the biggest category out of those modifiable risk factors was hearing loss. Treating that hearing loss could have reduced the risk of the onset of Alzheimer's. Now, this information, we've been seeing it now at least since 2011, and it's really been our job to get that information out there. We've talked about better hearing for a long time, and when people think about getting their hearing tested, getting it treated, they're usually thinking about just improving hearing. And that's still the case, but now we're looking at long-term effects of treating that hearing loss. Yes, we want to hear our loved ones better. Yes, we want to hear what we've been missing, but we also want to keep the brain healthy and working the way it should. I encourage you to do some research for yourself, and if you have questions or would just like to find out where is my hearing at, come see us, and we can help you get started for better hearing and better brain health.